Cholesterol. It's a word you've heard before, but what exactly is it? Hey guys, it's me again, Dr. Babes, and today let's talk about your cholesterol and understand its role. Well, cholesterol isn't all bad. Our body actually needs it for many cellular function. It provides some of the structure of the cells in the body and is essential for making hormones. So where does cholesterol come from? Two sources, your body and food. Your body, especially the liver, makes the cholesterol that you need and it circulates through the blood to your other organs. Now, some of the cholesterol found in your blood is also contributed through our diet or food, especially from animal sources like meat, poultry, or full-fat dairy. So these two mechanisms are related because the liver produces more cholesterol when you eat a diet high in saturated and trans fat. When your doctor asks you to have your cholesterol checked, it is usually called a lipid profile. You would notice different types under it. There's LDL, HDL, total cholesterol, and other stuff written. But what does that mean? So we actually have different types of cholesterol. HDL is the good stuff. You want your levels of HDL to be high because it actually helps clear your body of the bad cholesterol, aka LDL. QRS, TUV, WXYZ. That's an alphabet joke. Let's start with LDL, or the low-density lipoprotein, or also known as the bad cholesterol. Remember that LDL starts with an L, and you want to keep it low. L is for low. But why is it called a bad cholesterol? So LDL is made in the liver, as I mentioned earlier, and it swims around your bloodstream, and then it gets into your blood vessel. It deposits cholesterol to the blood vessel walls, creating what we call an atherosclerotic plaque or fatty plaque. So let's go into this in a little more detail and talk about why it's a bad thing. For example, the blood vessels to your heart. If you think about it, your heart is a muscle that pumps all day, every day. So it needs oxygen from the blood constantly. Therefore, we need to keep these blood vessels open. Blood and oxygen are kind of the heart's main job. Also, love. What happens if you have high cholesterol is that the LDL that circulates in your body deposits cholesterol on the blood vessel walls. Once it's deposited in the walls, the body's inflammatory cells detect it and comes to the site where the cholesterol is deposited and engulf the cholesterol. However, this activates even more inflammation, which makes the plaque bigger and bigger. So here comes the two mechanisms in which it causes problems. One is that the plaque becomes thick and hard, and this can narrow the arteries and make them less flexible. This condition is also known as atherosclerosis. It can limit the blood flow, and if blood flow is limited, the oxygen and nutrients are limited as well. So these can manifest as chest pain when exerting effort, like walking up a flight of stairs. Because when they exercise the heart rate increases and the heart needs more oxygen. And that plaque is limiting the amount of blood flow that can get to the heart. Now, second is that this plaque has what we call a fibrous cap that covers it. And this cap can thin out due to the inflammatory process happening, break open, and then cause the cholesterol to spill over to the bloodstream. And when that happens, the body's reaction is to form a clot at the site of the rupture. So what this clot does is that it completely limits the blood flow. So let's go back to your heart. If you think about what happens to your heart that needs oxygen all the time, if you have an occlusive thrombus or a clot that completely cuts off the blood flow to your heart, that piece of heart muscle will be deprived of the oxygen and starts to get damaged. and can die. And that's what a heart attack is. These can also occur to your blood vessels supplying your brain. And in the same way they do damage to your heart, the plaques can cause problems in the brain. And if you have a complete blockage, you have a stroke. Well, all is not grim for cholesterol. If we have the bad cholesterol, we also have the good cholesterol. Or you can see it in your test as HDL, or high-density lipoprotein. And what it does is exactly the opposite of LDL. Think of LDL as the garbage man of the body. It removes or pulls the cholesterol out from the fatty plaque and from the bloodstream and takes it back to the liver, and then into your bile and get rid of it through your stool. So remember that we want to keep our HDL high since it has a protective effect preventing cardiovascular diseases. Another type you can note is the triglycerides. This is like the building blocks or Legos that make up your cholesterol, and these are stored in fat cells and serve as energy source for the body. So usually high levels are found in people who are overweight, with high cholesterol, or those with diabetes. So these three are the major components of your cholesterol. Now I want you to remember a simple formula. Your HDL plus your LDL plus your triglyceride equals your total cholesterol. Just a tip, your total cholesterol should be less than 200. So now you have an idea on what all these numbers in your blood test mean, and this can indicate to your doctor your risk profile and whether any intervention is required. Now, different people have different levels of cholesterol and different ratios of good to bad cholesterol. But you might be thinking, nah, I'm too thin, I don't need my cholesterol checked. Or, this doesn't apply to me because I'm not overweight or not obese.
That's suspicious.
Well, I am here to tell you that that is not true. Cholesterol screening is recommended for everyone, especially if you have family history and risk factors. So even though it's true that overweight and obese people are more likely to have high cholesterol, still, anyone can have high cholesterol even if you are slim, eat well, and exercise. The standard now is that cholesterol monitoring should begin in our 20s, even if you don't have symptoms of heart disease. That's because high cholesterol is showing up in more and more younger people. 1 in 5 kids and teens in the US between ages 6 and 19 already have it. Hi, I'd like to set an appointment for cholesterol screening test to set a great example for the youth. And that goes back to what we said in the beginning, that high cholesterol can be brought about by 2 factors, and one is what you eat, and the other is your body's ability to create cholesterol, and a large part of that is determined by your genetics. Now, some people can be thin or petite, but have high cholesterol because it runs in their family, or someone with Southeast Asian ancestry, which tends to have higher cholesterol. Advancing age and being old, being of male sex, or early menopausal women, these are also some of the several other factors that may also increase your risk, but cannot be readily changed. And all of these have a higher likelihood of having high cholesterol levels. So how do you know if you have a high cholesterol? What are the symptoms? There are usually no symptoms of high cholesterol. However, some patients may experience symptoms linked to associated cardiovascular disease, such as chest pain, as I mentioned earlier. It is often a hidden risk factor, which means it can happen without us knowing until it's too late. That is why it's so important to get your cholesterol level checked. Okay, so now you've got your cholesterol checked and your results are out, and you see that your LDL or your bad cholesterol is high. What should you do? Well, you can't control your genes and you can't control how much your liver is making, but what you can control is what you're putting inside your body. So choosing a well-balanced diet can provide benefit helping you reduce your cholesterol levels. Taking fish oils or omega-3 supplements also have some evidence of suggesting that they can reduce circulating blood cholesterol levels, but it is also important to recognize that these should not be seen as replacement for a healthy, balanced diet. Now, reducing your alcohol intake within the normal recommended allowance will also provide further benefit in improving your numbers. Exercise is also a great way to manage your cholesterol. Studies show that exercise raises your HDL or your good cholesterol and lowers your LDL or your bad cholesterol. It is also recommended that you quit smoking if you are, because smoking causes direct damage to the walls of your blood vessels, making it more susceptible. It raises your LDL and lowers your HDL levels. Cigarettes are bad for you. Really bad. Wake up, people. In fact, cigarette smoking accounts for about a fifth of all heart disease deaths in the US. And I don't mean to burst your bubble, but vaping isn't any better for you either. Hear that, you 26% of millennials who think e-cigarettes have no effect on your heart?
No. It was at this moment that he knew. He fucked up.
Really? But the good news is, you can quit. And if you can go just one day, 24 hours, your risk of heart attack already starts to decrease. And if you can quit for 1 day, you can quit for 2. And if you can quit for 2 days, why not 200? A full year of not smoking will reduce your risk of heart disease to half of that of a current smoker. And if you quit cigarettes for 15 years, it's like you never lit up at all. That's almost as good as a real-life reset. Next is losing weight. So when you lose the weight, you lose the fat, you lower down your cholesterol levels. Number 5 on your priority list is when you've done all the other things that we've mentioned. Now, some individuals may need cholesterol-lowering medications to reduce their cholesterol levels and overall cardiovascular risk. Statins are the most commonly prescribed medication used to reduce cholesterol. They are the mainstay therapy for hyperlipidemia or high cholesterol. I made a separate video discussing how statins work, who needs it, or how to take it, and if you want to know more, make sure to check it out. We'll be posting it soon. However, some patients may not be suitable for statins and therefore may require different medical treatment. So there are other options available such as fibrates, bile acid sequestrants, or ezetimibe. Make sure to consult your doctor as every treatment is individualized depending on your risk factors. When it comes to your cholesterol, remember to check, change, and control. That is to check your cholesterol levels. This is key to know your numbers and assess your risk. Change your diet and lifestyle to help improve your levels. And third is to control your cholesterol with the help from your doctor if needed. I hope you learned a lot from us today. This is your good doctor telling you to know your numbers and always stay informed. Subscribe for more tips and updates. Thank you for watching.